Welcome to Hope Natural Health, the podcast inspiring you to be your best version. Join me, your host, Dr. Erin, naturopathic doctor, dog mom, cancer survivor, and girl boss weekly as we discuss all things health, hormones, and happiness with a little side of this thing called life. We are back for our second part of this series with common PMS symptoms. But I wanted to mention last week, we obviously talked about common PMS symptoms part 1. You can probably listen to part 2 without part 1, but let's be real. Let's listen to them all because you're going to learn some symptoms that you might be having that are actually abnormal. So go back and take a listen to part 1 if you missed that. But today we're going to talk about weight gain. And weight gain is a common PMS symptom that obviously is not a friend or one that we want. And weight gain can be outside of our period too. But hormones fluctuate during our menstrual cycle that can cause water retention and a buildup of gas in our digestive system, which therefore can lead to us feeling full, discomfort, and even swollen, like bloated feelings. So if you've had some of these symptoms, especially the bloat, I hear a lot. It's a common PMS symptom, but it's a sign that we've got something unbalanced with our hormones. So also when we menstruate, our uterus contracts, which therefore causes more discomfort and bloating. So like I mentioned, it's normal to feel bloating to some extent, but if you're feeling like you're 9 months pregnant and experiencing chronic effects of bloating, it's most likely your hormones are unbalanced. So that's where we like to test. The next one would be your length of cycle. So the average length of a menstrual cycle is anywhere from 26 to 32 days. So that's from the day 1 to the next day 1. So if it's any longer than this or shorter, it's probably due to a hormone imbalance, a thyroid dysfunction, maybe you're not eating enough, perhaps you're not ovulating, among many other reasons. So if we're also bleeding more than 7 days during our menstrual cycle, this is abnormal. So that I talked about flow and where this is abnormal in the previous part 1. We also want to note that our cycle should be regular for you. So it shouldn't be 25 days 1 month, then 42 the next. Being off a couple days each month is okay, but if your period is literally like a ping pong game or even irregular to the point where you have no clue when it's going to come, this is also not normal. And then the last symptom would be moodiness. So there's some hormone component to moodiness, specifically way too much estrogen, but other factors like our blood sugar, gut health, liver detoxification are also important. Mood changes can range anywhere from feeling sad to hopeless to having some anxiety and irritability. So have you ever heard of our gut-brain connection? This is if you've had gut dysfunction, your brain is totally impacted. Like that's why we get mood swings. So this is why it's important to have regular bowel movements, at least one well-formed, easy-to-pass stool a day. So if we're not pooping, we're also not excreting our hormones either, which then can lead to an excess accumulation in our body. Also, when we talk about liver detoxification, our liver is like a pool filter. It's literally filtering everything we put into our body. So if it's congested, it leads to overabundance of our hormones, specifically estrogen, which is usually the culprit to many PMS symptoms and period irregularities. And then lastly, we have blood sugar. So sugar is actually more addictive than cocaine and crack. The average American eats about 152 pounds of sugar a year. We love it because it makes us feel better and it hits our dopamine receptors in our brain, which is our pleasure and reward center. So the side effects of sugar, though, really aren't worth it. And the impact it has on our hormones leads to higher estrogen, lower progesterone, can impact our cortisol, which is our stress hormone, and even our thyroid function. So with moodiness, what is abnormal? I would say anywhere from feeling like you're going to lose your mind. A patient once told me that her kids referred to her period as Shark Week. So if this is you, we've got something going on with your hormones. So when we wrap this up, like, how balanced are your hormones? So just because you've been told your hormones are balanced or normal does not mean they are optimal. The only true way to determine this is to have your hormones tested on the last half of your cycle, usually cycle day 19, 20, or 21. Or if you have a longer cycle, 7 to 10 days post-ovulation. This is where progesterone is supposed to be at its peak and a good indicator of our optimal hormone levels. So if you're experiencing any of these symptoms mentioned here in this episode or last week's episode, it would be a good idea to check your hormones, because we really want them to work for us, not against us. And if you understand where there is abnormalities, we can really pinpoint, the area of the cycle that needs the most amount of work. Because every day is different for us. Our hormones fluctuate every single day of our menstrual cycle. So to be quite honest, nothing is really consistent in women's health or women's health. In a menstruator, we'll say we're all over the place, but it needs to be balanced, and it can be balanced. So if you haven't taken the period quiz, I recommend starting there, because you'll probably learn something. But if you have and know, be like, this is me, I have a Hope for Hormones program that can test your hormones. So it's super easy. It doesn't require any blood work. The kit is sent to your house. You spit in some tubes, send it out. Once we get your results, we'll send them to you with what I like to call like a done-for-you analysis. So basically, it's going to say, if you have this, then this is the reason why, and this is what you can do about it. So it kind of gives you education around every single one of the tests that's run on there, which is your reproductive hormones and your cortisol. It doesn't include your thyroid, so that's something that you can ask your physician for. But it'll help us understand, the estrogen progesterone balance. Maybe we have a little bit more testosterone, and even if the adrenal function is impacting our hormones. So we'll include the link for that in the show notes. But I hope this was helpful. And what I've learned over the years is a lot of women don't know that there's PMS symptoms that are abnormal, because it's been normal for them. And a lot of these symptoms have been normalized. And we also have been brushed off by other practitioners, like, oh, that's just the way it is, or there's nothing that can be done, or the only way to fix it is you have to take birth control. And all of those things are completely false. You do not need to take birth control. It's not going to fix your period. There is something wrong. It can be fixed. And you are the advocate for your own health. So that is what I'm here to help educate you on, is that we don't know what we don't know. So when I point out these things, hopefully it's like, those little, things that make you go, So I hope that you learned something. And if you know someone that's suffering from PMS, maybe you have a coworker that's consistently calling out the same time of the month, or maybe your daughter's suffering, or your sister, or whoever the case may be, share this with them. You can find me on Instagram or social media. I'd be more than happy to answer your questions. But I hope this was helpful, and I look forward to seeing you all next week.